As I look at what we've accomplished, I think it's fair to say there really is greatness, there really is excellence at Mount Sinai in a way there's never been before. We are on the verge of discoveries and advances in areas of neuroscience, cardiology, oncology, surgical procedures that really can revolutionize medicine.
What keeps us going is the excitement of the discoveries and the opportunity to make a real impact for humankind.
What's so exciting here is that it reflects the type of scientific excitement that existed in the day of Galileo.
The winner of that really is the patient. The patients are really benefiting the most from what I perceive as really raised expectations here across every level.
Our vision for Sinai was to go from being a well-respected, good academic medical center to being one of the leading medical centers in the world.
Mount Sinai today is a great institution because it's not only the expertise in clinical medicine, but it's the academic drive, the research, the recruitment of outstanding investigators.
We're doing things that when I started out at Mount Sinai 20 years ago were simply unthinkable. The notion that we could take a small piece of skin, grow up some cells, and then make heart cells in a dish was something none of us would even dare dream of.
What we are doing in the laboratory is very, very exciting. It is an exciting journey, and in a way, it is a dream come true. We are able to use reverse genetics to make a vaccine against human influenza, and this was used against the swine influenza, the pandemic H1N1 in 2009.
Our aim is to really become a hub node at Mount Sinai that links seamlessly to all the other disease-oriented institutes, whether they're focused on schizophrenia, autism, Alzheimer's, obesity, diabetes, heart disease, or different types of cancer.
Our scientists were among the first to clone the gene that is in the major biochemical pathway that leads to Alzheimer's disease.
One of the characteristics that distinguishes Mount Sinai as a medical school and a hospital is our culture of collaboration. Our scientists collaborate with our doctors. Our doctors collaborate with our scientists. For example, more diseases have been named after Mount Sinai doctors based on the work that they do in the clinic than any other hospital in the United States. Our scientists that are making discoveries in the lab, they're going to be picked up by our doctors, and they're going to change the way medicine is practiced.
When you have groups of creative and innovative people working together, that's when breakthroughs occur.
We are now able to see who is developing the disease that is the #1 killer, atherosclerotic disease, either of the brain or of the heart, and we can see it before the heart attack.
The predominant program that we're known for nationally here in cardiac surgeries and mitral valve reconstruction.
The first drug that has extended life for patients with liver cancer was led by scientists here.
We can develop targeted therapies of an array of cancers that range from breast, ovarian, lung, sarcoma, and other tumor types as well.
We did the first living donor liver transplant, the first deceased donor liver transplant, the first intestinal transplant.
Mount Sinai combines great science with an unwavering commitment to humanity.
It never ceases to amaze me what has been accomplished. The commitment to excellence in patient care has always been here. From the day that the hospital opened, the goal was always the same, to render the best patient care that we knew how. And that has improved with time.
Palliative care is a model and actually a revolutionary approach to health care. In a very real sense, we're offering patients care that meets them where they are and says, what is important to you? What's on your mind? What keeps you awake at night?
I think what we're doing here in the Dubin Center is really putting a focus on the patient at the center of the care model. And it's really all about the patient and making them feel comfortable, making them feel as though they're really the center of the world. Because for them, they really are the center of their own universe, and it's our job to sort of save that little world.
I did the first procedure repairing an aortic aneurysm in the United States. fixed the first ruptured aneurysm in the world.
Now we're using robotic technology to access the throat and remove tumors. Patients that were in the hospital for 2 weeks after a 15-hour surgery, the surgery's 2 hours and they're home the next day.
Our clinical research team identified a drug called Ketamine, which is a rapidly acting antidepressant. It is the first new antidepressant treatment available for depression in several decades.
I treat about 18,000 patients per year. Since December of last year, you are the first one to replace that aortic valve without surgery.
What excites me is that we can change paradigm in medicine. I think it's a very exciting time for immunology in cancer right now. The impact I'm trying to make is to identify new immune targets for the treatment of cancer.
I pioneered an integrated systems biology approach to study how stem cells make decisions.
In the Department of Pediatrics, we're doing some pretty amazing things in performing pediatric kidney transplants, truly a life-saving procedure. We also perform liver transplants, small bowel transplants, and bone marrow transplants.
My basic science lab here at Mount Sinai focuses on why tendon damage happens to begin with and how we can better repair it.
In the last few months, we've had the first in men clinical trial in gene therapy for heart failure, which showed for the first time that this approach can reverse the course of congestive heart failure.
Our special area of treatment includes minimally invasive endovascular repair of aortic aneurysms. With this therapy, we can implant a new artery inside of the existing artery, repairing damaged walls, weakened walls, and prevent patients from the risk of rupture of their aortic aneurysms.
I wake up thinking about new experiments, new approaches.
There is nothing as exciting for a researcher to go into the lab and to see for the first time something that nobody else in the world has ever seen or understood before.
The desire to find the answers, to understand the basic mechanisms behind food allergic reactions, to understand how we can treat them.
These are incremental steps which we are going through. We are working really from day to day, and it is not every day an aha day or a eureka day that we think we found something, but all together, when we see the great picture, the overall piece of work we have done, this is extraordinarily satisfying.
We are truly entering a new era in Mount Sinai's history.
We're on the verge of one of the most amazing transformations to take place in the biomedical and life sciences.
What we're working on is a vaccine that will be required to be taken only 3 times in your lifetime, and it will prevent influenza for your lifetime.
By attacking the tumor by different approaches, we think we can help to control it, and in some cases, to be able to eradicate that disease.
Mount Sinai has been at the forefront of personalized medicine, and their approach has been to first put in a real infrastructure of biobanking, which they've invested in from the very beginning before many places even knew what personalized medicine was about.
Our goal for the Freedman Brain Institute at Mount Sinai is to build one of the world's leading research institutes focused on brain and spinal cord disorders. The opportunity to add somewhere around 30% to the research footprint of the medical center is, I think, unprecedented in the country.
If I had to pick one area that excites me about the future of Mount Sinai, it's in the area of genomics.
From a therapy standpoint, we are really at the edge within a few years to make gene therapy a real mainstay of treatment that every patient in the world can have access to. The mission of the Institute for Genomics and Multiscale Biology is to take all of the data relating to disease that exists within Mount Sinai and all the disease-oriented institutes, to integrate that data. We will be able to come up with the most predictive models for disease biology and how best to treat and diagnose disease, so that ultimately the outcomes at Mount Sinai will be distinguished from the outcomes at other centers.
There's never been a division of psychiatric genomics here before. The goal of our groundbreaking study is to get genetic information on 100,000 people so that we can find new genes for psychiatric disease.
I believe that Mount Sinai will be at the vanguard, at the cutting edge, for how genetics changes the way medicine is practiced.
We are now on the verge of making real differences. We've extended life.
We've achieved what we all dreamed we would achieve. It took a special place, a special time, a special group of trustees, a special group of management, and the right scientific foundation. But it all came together now. An era that can be characterized as Mount Sinai not just being a great regional hospital, but a great global hospital, a leader in the world, among the very best on planet Earth. I'm convinced that today we live with giants. These at Mount Sinai are truly the days of the giants.